NHS Trust recorded the largest ever deficit in the history of the health service, according to figures published in May 2016. The NHS has a 10 to 15% real-term cost reduction target to be achieved by April 2021. 60% of the costs of running an NHS Trust are attributed to staff. The NHS spent £3.7 billion on agency staff during the 2015 to 16 financial year.
Clarity is part of HCL Workforce Solutions, which is one of the largest providers of temporary and permanent healthcare staff to the NHS and private sector, so doctors, nursing, social workers and allied health professionals. We're government approved, which means we've been through the rigour of pricing, clinical compliance, and we're on all of the national frameworks. In the time that we've been working with the NHS, we recognised that the high levels of agency usage were unsustainable, and it would only be a matter of time before the government would put pressure on the system to rein this spending in. There are huge shortages of skilled workers, both from nursing, medical space, within the allied health professionals, and therefore there is a huge need for temporary staffing. But we believed that the process started much further back in the planning, and that it was really about good rostering. So in 2012, we embarked on a journey with Skillstream to develop e-rostering technology.
We spent, I'd say, around about 7 years of blue sky thinking, in that we wanted to very much look at a new way of rostering. I mean, we didn't want to revolutionise the way in which people are rostered, we just wanted to look at the way in which technology was used to do that. The real beauty of technology is to make something very complicated simple. We're using the most modern technologies to enable and to make the process much easier to use and more fluid. And I think all of these things combine and culminate in this new Clarity product that we're very excited to launch.
Clarity's product offerings include consultancy, powerful e-rostering tools, in-house bank management, and also agency supply chain management. If an organisation tackles its e-rostering challenges head on and starts to analyse and reduce the number of gaps in rosters by the efficient deployment of the current workforce, we estimate that the saving is between 5 and 12% of a total pay bill. Now, when you think that the NHS costs in excess of £100 billion a year to run, of that, the workforce bill is around 60 billion. You can start to see the substantial savings that can be borne out of efficient rostering.
We will look at a ward and we will break it down by the activities associated to servicing that ward. And then we roster the workforce, both the permanent workforce, the bank, and the agency workforce against that set of requirements that is needed to service the ward itself.
If you give the Trust the tools and the technology to build in-house banks and to be able to run their own contingent staffing, again you can see that the demand for agency workers is ultimately reduced. And if we reduce the demand for agency workers, you start to see the price point of agency provision come down. Given the challenges the system faces today, it's our endeavour to provide powerful tools to ensure that we've got the right people in the right place at the right time with the right skill mix.